Hi guys, welcome back to my channel. My name is Fumilola. As you know, okay, just in case this is your first time, my name is Fumilola. I'm a double board certified pharmacist. I'm a mom of two, a wife, and I'm on a self journey. It is my hope that I'm able to inspire at least one person to get on a journey of their own. And if I'm able to do that, then I guess this will all have been for something. Okay, so let's get into it. Today we're going to be talking about pregnancy shenanigans. I call them shenanigans because I thought about calling them symptoms. I'm like, symptoms doesn't quite cut it because it may or may not happen. Well, I mean, symptoms are possibilities, not facts anyway. So, a quick backstory. I always give you guys a short backstory on why I'm making a video. This particular video I am remaking. Because the first time I made this video, guys, I didn't have my mic on. And I enjoy shooting that video so much. I'm just like, I hope this one is as nice as that one. But the original reason why I actually shot that first video was because I came across a video from Maraji where she was talking about pregnancy rhinitis, and then I had been wanting to make a video since about pregnancy symptoms and all sorts of stuff that can happen. And I was just like, oh, maybe I should make this video now, because people in the comment section were like, oh, I never knew that was a thing. But then, and I realized that because going back to one of the videos that I made earlier about how women's conditions are always misunderstood and misdiagnosed because there's not enough research, right? So when it comes to pregnancy, there's all sorts of things going on. So sometimes you don't even know which one is pregnancy and which one is your body just doing what's going on with it. Because of that, a lot of women suffer through these things and think that they're alone in it. I think that something is wrong with them. I think that they're, especially, altered. So today I went digging around chat rooms, ChatGPT, Google, internet, personal experience, and I'm bringing you guys about 101 shenanigans that you can go through in pregnancy. So let's get into it. Syncope, in layman terms, fainting. Some people just drop anyhow in pregnancy. And it's much English. Of course, that probably has something to do with their blood pressure lowering too much, and then they just faint anytime. Pregnancy-induced headaches. This one is it's such a real thing that, as in, my friend who is pregnant has had headaches almost from the beginning of her pregnancy, and she's just like, "What is this?" Unfortunately, you can't take anything stronger than Tylenol, half of the time. Tylenol is not really doing anything about that headache, but I mean, it is what it is. Excessive sweating. You just be sweating. I remember that in both my pregnancies in third trimester, I used to want to walk around the house without clothes because it should just be like, apart from the fact that it feels like the sweat is just rubbing off the wall on you, are sweating, you are, even when you shouldn't be, you're sweating in odd places. Change in body smell. This is something that a lot of people have also reported. They feel like their sweat smell has changed or their body smell has changed. Then there's also pregnancy-induced rage. Say, na pregnant woman, will leave one before she go bite you. It's actually pregnancy-induced rage. In one of the chat rooms where I was following like pregnancy symptoms and stuff, one lady talked about how she missed when she was pregnant, that because usually she's a peaceful person that lets things go and everything, but anytime she's pregnant like this, it's as if her tolerance for BS just reduces. What's me unusual? Like, so she wasn't like she misses it, that she was more assertive, she was more, but that she was also a raging bitch, like she could not tolerate any, her tolerance level was zero, right? So yeah, pregnancy induced rage is something. It's increased body temperature. You just find that your body is warmer all the time. Of course, there's just a lot of science behind that, but yeah, that also happens. So we'll talk about some digestive issues. Loss of taste and smell. Yeah, I think we've talked about that already. Increased smell, but loss of taste and smell is sometimes tied together. Um, some people have up, upgraded taste, but most people have loss of taste and smell. In fact, sometimes it feels like you have a cold, like you just have a perpetual cold. You can't taste, you can't smell. Then vitalism. excess saliva. She suffered this one. I remember that she started to carry this stainless like a flask or whatever, a cup about, and she starts spit inside. And my mom is someone who's very finicky, she's very neat and everything. So to see her carrying her around her own personal spit cup, I mean, it was hilarious. But yeah, she had to, for all the pregnancies that she carried around spit cups. Okay, now people have teeth problems. Guys, when I saw this one, I said kilo dental decay, losing your teeth, jaw pain, dental caries. And they say you can, if you brush frequently and you keep good oral hygiene, it might be helpful, but it's not a guarantee that you will not lose a tooth. Also, one of the things I'm going to say about bone and teeth problems in pregnancy is most likely the mother has a calcium deficiency. Um, I always say that the way that Mother Nature designed the body of a woman, it is to, what I'm about to say is, I mean, it's not very feminist thing to say, but it is unfortunate that that's what it is. The body of a woman was designed to give life. Now, what that means is that, of course, if you have fertility issues, not as if your body wasn't designed properly, but you guys get what I'm saying. The body of a woman was designed to give life in such a way that when you are pregnant, all attention, all nature's attention is focused on that baby, such that if the baby needs calcium, they will take it from you. So if you're not supplementing, it means that you're going to be leaching calcium in your bones and your teeth, and then you're going to be having weak bones, weak teeth, and then all this losing teeth and everything. There are a lot of people that talk about losing teeth in pregnancy. So if your baby needs iron, for example, and they're going to take it from you, and then if you don't have enough iron, you're going to be iron deficient. So these are the reasons why you need to supplement in pregnancy, because a lot of things that your baby needs, your baby's gonna take from you. And the baby doesn't know, oh, mommy has 10, but mommy needs 5. Let me just take 5. No, if mommy has 10 and baby needs 9, baby is gonna take 9. You are left with that. If a baby needs 10, baby will take 10, baby will take 11 self, and you are left with that minus, the deficit of it all. So you need to take care of yourself. Of course, there is nausea and vomiting. I remember that I have always been so proud, my pregnancies have been, my son was like a textbook pregnancy. It was, I mean, the only way that I knew that I was pregnant was tenderness in my breast. My daughter, though, I had nausea. I vomited once. I think I was brushing and I gagged and all. But I had a friend who, when she was pregnant with her first, I don't think it was as bad with her second. She had hyperemesis gravidum. That is overthrowing up in pregnancy. Basically, that's the translation of what I just said. And I remember that she used to have to, like, we could just be gisting. She's like, I'm coming. She just go, "Boo, boo, boo," like, just randomly in the middle of the day. She didn't eat anything. She's just throwing up. As in, so yeah, people have that. Then there is polyphagia slash lack of appetite. So polyphagia is eating a lot. Like, you want to eat everything you see. There are some people like that. And there are some people that they have zero appetite. Like, these are also two ends of the spectrum. And some people oscillate between those two ends sometimes. Then of course you have the quadrifecta, I believe they call them, constipation, diarrhea, bloating, gas, heartburn, flatulence, burping. Those ones, I mean, all of them like that are things that people experience in pregnancy. Some people have all of this constipation today, diarrhea tomorrow. Like, it just goes around. Constipation is a real thing, though. I remember when I was in Nigeria and I sold a heartburn medication that also helped with like reflux. Pregnant women were our standard. Also, one of the safest medications used, now talking as a pharmacist, one of the safest medications used in pregnancy when you're constipated is Mistmag, because Mistmag has, like, I mean, it's a 2 for 1. It will give you some magnesium in there, and it helps you to go to the washroom. So, you know, that's a good one for you if you're pregnant and you're constipated, because I know a lot of pregnant people are constipated and they're constantly worrying about what they want to take. Also, some of the supplements that you take in pregnancy will make you constipated, like the iron and the calcium, and pregnancy itself. So imagine that, having everything together. That's like constipation extraordinaire. Metallic food taste. So people report in pregnancy that things taste like metal, like things taste like metal, number one. water tastes like metal, their saliva tastes like metal. So randomly their mouth just tastes like metal, right? Um, I mean, there's nothing you can do about that. Again, it's modern nature and all that shenanigans. I think that one of the most annoying things about all the symptoms of pregnancy, if you tell a doctor, it's like you're pregnant. I mean, the different things are going to be happening. We don't really think that there's much that we can do. Some people report rhinitis, congestion, nasal polyps. I put all this together because I mean they're all around the nose area. So, like Margie was saying, some people just have like runny nose throughout their pregnancy, right? Some people it is congestion throughout their pregnancy. Some people they have like polyps growing up in their nostrils and make it difficult to breathe, and they are stuck with like using steroid inhalers, and then they worry about the pregnancy. The steroid inhalers will help. I mean, the rule of thumb in pregnancy is zero medication unless absolutely needed, right? But if it's something that you need, then you need to go and see a doctor about it. There's also spicy food cravings. I remember when I was pregnant with my son, I would cook and I would just eat, but I would see my husband, babe, this food is spicy. This food is spicy. And I was just like, what's he talking about? The food is just normal taste. And I liked eating white rice and ejakika sauce. So I would make the ejakika sauce because I wanted a certain level of spiciness. And he'd be like, oh, it's really good and all that, but his nose would be running and he would just be doing while he was eating. I remember that shortly before I had my son, I had made one of those my famous ejakika sauces. And then after I had my son, the nanny took out the sauce to heat it up for me for rice. I took one spoon and I was like, what? How were we eating this? And I told my husband, I said, babe, how are you eating this? But it was nice now, but it's so spicy. I said, this is too, it's just, I couldn't eat it. I was like, oh my God, I don't punish this man. Go. But yeah, I remember that. So some people have extremely high tolerance for spicy food and even crave it, right? Another pregnancy shenanigan is feeling full all the time. Like my pregnant friend was saying that she has a question. That what is this conundrum of oh, you need to eat properly, but at the same time your stomach size is reduced, and at the same time you can't eat a lot because your your stomach size is reduced, then your gastric emptying time is slowed down, which means your food digests slowly, and they expect you to actually get more food in. How do they expect you to get more nutrition in? And so me and my other friend in the call were laughing at her. We're like, babe, you need to eat smaller, more nutrient dense meals, not necessarily dense meals, nutrient dense meals in smaller portions more frequently. That's basically the three laws of eating in pregnancy. I mean, because otherwise you're just going to realize that you're not getting your nutrition in, and low birth weight and all those things can actually also step in. Alcohol craving. When I was pregnant with my daughter, I would go in the fridge and I open the bottle of Baileys and I would just sniff it. Just like that's why I was like, what are you doing? You can't drink. I'm like, I know I cannot drink, but smelling is not against the law. I mean, are they catching people for smelling alcohol? And the guy is just like, you know what, sniff your sniff in peace. Yeah, so I also remember one of my friends that told me that when she was pregnant, I mean, her kids should be in their 20s by now. Said there was a beer parlor not far down their street. That every night she would go there and drink a bottle of stout. But they knew her all her pregnancies. Every night a bottle of stout. I said, this woman, you shouldn't be drinking pregnancy. Of course, she didn't have a medical background. We met at baking school when I went to learn sugar crafting. Yeah, I used to bake. So she was saying, like, well, she has born the children, there's nothing that is wrong with them. So that one, she will take it under advisement for next time. But yeah, she drank all through her pregnancy, and well, to the best of my knowledge, the kids are fine. Hemorrhoids. Hemorrhoids and pregnancy, they are like these guys. They're like best friends. Constipation, we already said constipation and pregnancy are best friends. So hemorrhoids are, just creeping after. So most of the time, if you can't get that constipation under control and you're straining and you're straining and you're straining, most of the time you develop hemorrhoids. And once they pop out, they don't wanna go back in. So the solution to that is not to have it. If you have it, well, you can manage it with creams and like all those steroid preps that they make to help with the hemorrhoids from being too painful, right? But yeah, hemorrhoids. Weight gain. Bah. Weight gain is something that I do. In fact, I think that the fourth trimester, which is after you have the baby, is when that weight gain is gonna pop up on you. So what usually happens is that if you even if you can manage your pregnancy properly, you gain maybe 10, 15 kg in pregnancy. This is normal weight gain. Anywhere between 7 and 15, I believe, is normal because baby will weigh like 3 ish. Some babies weigh like 5 kg, but let's say baby will weigh like 3, 3.5, 4 kg mark, like 4 kg. The fluid and everything, and adipose. So let's say between seven. If you are like fit farm, you wanna kill yourself, you might not gain any weight, but technically you'll be gaining weight, which means you're losing weight as a person, but so your weight might stay stable, but the baby will be adding to the weight that you should have had. So when you now have the baby, the first couple of days after, your body just back down like that. So just like, oh, I'm gonna get my body back, I'm gonna snatch, I'm gonna, yeah, it is a setup. You see that first 2 weeks after you have the baby, when your body drops and you're feeling as if, yeah, I got this mom body snatching thing on point, on check. You have to be careful, because then you're going to start lactating and breastfeeding, and then the hunger is going to come, and you're going to be eating like there's no tomorrow, and then the weight gain is going to come, and then before you know what's happening, you are moving from your size 8 to 14, right? So yeah, weight gain is a very real thing in pregnancy that I would say 90% of women struggle with. The people that don't struggle with this in pregnancy, they struggle with this in their fourth trimester during lactation. Bleeding gums. I should have put this one together with the dental. People report bleeding gums in pregnancy, like they are brushing and blood is just, this is also probably a defect of something, right? So, yeah, it's probably a defect of something. Keep your supplements up, basically, in pregnancy. Keep your supplements up. You're going to need it. Your baby needs extra supplements that your body cannot produce. So this one is just a random whatever. Somebody was talking about how she noticed that her pets are more cuddly and protective of her when she's pregnant. And a lot of people also talked about, in fact, somebody talked about how her cat that usually just behaves as if she's not in the room, started that's how she knew she was pregnant, that the cat would curl up on her tummy and just stay there and be looking at her. One said her cat used to constantly march on her tummy, like just tap, 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 tap. And then when she found out she was pregnant, she understood why. So animals also have like a sense about these things, right? So if all of a sudden your neighbor's dog is protecting you up and down, or your mommy's cat is starting to curl up on you, dear, go and buy a PT strip. Something might be happening. Okay, there's also vaginal infections and like vaginal shenanigans. So increased discharge. Some people report dryness. Some people report difference in smell of discharge or look of discharge. Right. So yeah, your vagina, because again hormones are all over the place, so they're going to affect the way that your body is gonna react. So vaginal discharge increase or in reduction is a thing. Difference in color, difference in smell, extra dryness is a thing. We've talked about the fact that some people have flu-like symptoms almost throughout pregnancy. So cough, cold, congestion, catarrh, random nosebleeds. Random nosebleeds, oh guys. Like, okay, normally in this kind of environment, when it's really dry, your nose can start bleeding. You're like, oh, maybe I need to put on my humidifier. But in pregnancy, your nose can just randomly bleed. There's, again, mother nature, we are trying to bring it. Like, some of these things are just like, what happened? We know keep person. Literally, we're trying to birth a person, right? But yeah, these things happen. Then some people have, I talked about it before, that some people have increased allergy to stuff. Some people talk about really bad skin itching, just randomly itching all over the place. There's also skin tags. Some people get skin tags. This probably has to do with their blood sugar levels, because if you have increased blood sugar levels, you might get more skin tags. So if you're having skin tags in pregnancy, make sure you get your doctor to do a gestational diabetes test for you. That's also something we're going to still mention, right? Then skin darkening. This one, you see that line that even does that linear Niagara with the color? That one is also part of the skin that is darkening, increase melanin production. So yeah, most people, I remember that when I had my son, my skin, I'm already a dark skin person, guys. So imagine that I got darker, and then it was like a line like this all came down. I remember after he was born, one day I was having my bath, and it was as if the dark skin was literally just falling off my body as I was having a wash. Some people had dark skin stays with them for months and months after. But yeah, skin darkening is a thing. Another pregnancy shenanigan that I want to talk about is hyperproduction of earwax. Like, some people legit have like their ears manufacturing a lot of wax in pregnancy. There's no explanation for it, but just like all the other things we were talking about, Mother Nature just decided that she wanted to play a quick one on somebody. Hip pain when you're sleeping is another one. Like you're lying down, you can't lie down on your stomach, can't lie down on your back. So you're lying down on your side, and then you realize that your hip is just hurting because I don't even understand it. Yeah. Another one that I think it's funny to me is clicking of the jaw. Like your jaw will be talking and your jaw will just be clicking. Like how all these things, I don't have explanation for them, but I mean, it is what it is. On one of the chat rooms that I was checking out for pregnancy symptoms, somebody talked about her labia growing bigger and fluffier. According to her, she said it was almost like it grew so big that it was almost covering up her clitoris and her pee, like her urinary whatever, small penis. That when she was peeing, the pee was going all over, all over the place. And she said after pregnancy, it didn't go back to size, like it just remained big and floppy there. So I don't know if that's something that's happened to you. You're not alone, I guess, because that's like I don't know if anybody wants to talk about that in public. So I feel like this video has gone on for long enough. So you know what I'm going to get? I'm just going to read the list that I have that is remaining because 101 is a lot of numbers. Okay. So edema, swelling, polyuria, peeing a lot, increased resting heart rate. Like I just said now, you have to just and you're just like, what's going on? Excessive dry skin. No matter how much you moisturize, you have to go over and over. Your skin is just drying out like you're scaly, like you're a lizard. Sore nipples or sore breasts, leaky nipples, hardened nipples throughout pregnancy. Somebody reported that her nipples were engorged and hard. They look like coins throughout pregnancy. I'm also a candidate of that, you know. And then, of course, there's the tenderness of the breast. It's what they call lightning crotch, like muscle spasms, cramps, sore abs, tailbone pain. That one I couldn't understand what tailbone pain is. Then some people reported that they are more susceptible to heartburn. Somebody reported that when she was pregnant, she could practically hear her heart beating. Like it was almost, it became louder. She became more sensitive to it. Then I think we talked about strabismus or worsening strabismus, so what we call quarter to four eyes or crossed eyes. Some people develop it in pregnancy, or if you have it already, it becomes worse and you can't control the muscles. Vitiligo, that yeah, so this one is I've seen it so many times that um where you lose your melanin on your skin. And for most people, once it starts in pregnancy, it never goes away. Stretch marks are the gifts that keep on giving. Well, with that one, they say if you rub your stomach, moisturize with oil, don't scratch. If you're going to have stretch marks, like I told one of my patients, say you're pregnant, if you're going to have stretch marks, you're going to have stretch marks. Don't stress about it. You can use some oils and stuff. I say, but just be prepared. If it's coming, it's going to come. Shortness of breath, especially in second trimester. My pregnant friend, when she's talking, she's like, I remember watching Maraji's video also where she was talking and she was laboring and I'm like this baby in her second trimester because this breathing is not here. But for some people, it doesn't happen. Again, pregnancy symptoms are possibilities, they are not facts. Some people get some people don't get any. Some people have all of it, some people have none of it. We've talked about, varicose veins, the ones that kind of pop out when you are doing all the standing and everything. Well, some people just get it in pregnancy. We talk about nosebleeds, we talk about preeclampsia. Sciatica, where you have that nerve that runs all through the back of your legs up and they hurt forever. And then, of course, we'll talk about heavy breathing, labored breathing. Let me see. I think that's all I have on my list for now. I can't remember if I talked about forgetfulness in pregnancy, also called pregnancy brain, but I probably did. Anyway, so let's not look as if I'm the bearer of bad news. There's some things that supposedly get better in pregnancy. So we talked about hair thickening and lengthening for some people. We talked about increased libido in some people. Some people have more energy. They're like energizer bunnies, pew 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 everywhere. Then there has been reported reduced flares in most autoimmune diseases in pregnancy, like rheumatoid arthritis, multiple sclerosis, IBS, psoriasis. Even though I have to say that some people get postpartum rheumatoid arthritis. That happens to me actually. I had RA in my left knee after my daughter, but it's gone now. Anyway, yeah, so people talk about reduced pain and inflammation in endometriosis when they're pregnant, reduced period-related migraine, especially in second trimester, because some people, because of all the hormones up and down, usually when people are getting ready for their period, some people have migraines. But some people still have it all through the first trimester, but if reported that in the second trimester, it does get better. Sorry guys, I'm rushing through the rest because I'm just like, this video is almost 30 minutes now, I'm sure. So There's lower symptoms or healing of peptic ulcers. There's less seizure activities in some types of epilepsies. And then, because of increased supplementation in pregnancy, a lot of people that have nutritional deficiencies find out that those deficiencies get better, even stuff like iron deficiencies and all that. So, thank you guys for watching my very long video. And fun fact, this video was recorded like 3 times. First time I recorded it, I forgot to put my mic on. I was so burnt, so I had to do it again. Second time I was recording, a friend of mine came into the house and I had to stop recording, and then there is now. So hopefully third time is the charm and you guys enjoy watching this video. If you have any pregnancy symptoms that you want to tell me about that I didn't mention, because I mean the list is inexhaustive. So yeah, please let me know about it. Oh, remember to like and subscribe and share this video with a pregnant friend or somebody who had any of these symptoms and thought that they were alone in pregnancy. Bye guys, I always appreciate your time and I'll see you in my next video.